So those who are joining late, please help them out with the page numbers. Chapter 22, page 411. So first, vitamin-like, see, vitamin-like substances, we have not concluded these substances or elements as vitamins yet. There are a lot of studies going on, a lot of debates going on. So based on these studies and debates, we call them as quasi-vitamins. They act like vitamins, but there are certain categories which they do not fulfill. So we can't call them vitamins as such. Okay. So the first vitamin-like substance is choline. So choline is an essential nutrient for human beings, and it is again mainly found in non-vegetarian food more as compared to vegetarian food. Okay, so the main functions of choline, your cell membranes, choline is the main structural component of that. Okay, to metabolize, to transport and metabolize fat. Transport fat from where? The fat that is stored in your livers. Okay. For these fat to come out of the livers into the bloodstream and go and be used up by the body system. Okay. You require choline as an element. Okay. It helps to make some important neurotransmitters as well. It helps in neurotransmission, especially the metabolite called acetylcholine. Acetylcholine. Okay, that's what helps in neurotransmission in a human body. Okay, it also helps in maintaining the homocysteine in blood. Homocysteine, again, it's a protein. It's found in blood. So it leads to a lot of lysis. Okay, homocysteine leads to a lot of breakdown of the blood components, RBCs, etc. To keep that to keep the homocysteine levels normal. That's what choline does as another function. So daily recommendation for men, it is 550 mg. For women, it is 425 mg. So good sources of choline, as I have mentioned earlier, most of the non-vegetarian food, especially red meat and all, not the white meat, red meat, beef, mutton, okay, eggs, one whole large boiled egg, seafood like scallops, shellfish, and other any form of seafood. Okay, these all are really good and rich sources of choline. Vegetarian sources, there are certain, for example, cauliflower, broccoli, nuts, some whole grain cereals. Okay, they also have choline, but it's not enough to the actual requirement of daily RD of a man or a woman. Okay, so that's about choline. Special notes: choline can be made in body, but it is not enough to support health. That's the reason why you require it from other food sources. Okay, therefore it must be consumed in your diet. A varied diet should provide enough choline for most of the people, especially who are strict vegetarians, who do not even consume milk or eggs. Okay, those people who will be at the risk of developing choline deficiency. Okay, so special attention has to be followed for people who are strict vegetarians, and the choline deficiencies could really affect your body system, specifically your liver, because if anyone in your family suffers from non-alcoholic fatty liver, start giving them choline-based diet, and you will notice the symptoms can subside. Okay, because see, fat is also stored in liver. Choline helps the fat to get out of the liver and be used up by the body. Okay, so enough amount of choline will ensure that fatty liver symptoms can subside. Muscles, lymphocytes in humans, okay, these all things can be affected. Disorders of these areas can come in if there is a choline deficiency. Birth defects can take place in kids who are born to mothers who are choline deficient. Okay. So the next vitamin-like substance is our carnitine. Okay, sufficient carnitine is critical in fat metabolism because it is essential to transport long-chain fatty acid from the cytoplasm of the cell into the mitochondria. Okay, in mitochondria is where the fat will be used up, energy will be produced. Okay. See, as a treatment guide for non-alcoholic fatty liver, it's always the endocrinologist who will be specialized in that. Okay, but when it comes to diet, Okay, when it comes to menu planning, when it comes to diet, try to add choline-rich food in there. Don't just jump into supplements. First, start adding more choline-rich food in their day-to-day diet. Okay. Also, people who are at a risk of getting fatty liver, okay, who had suffered from jaundice in their childhood, okay, any hepatitis infection has been there. Add more choline-rich elements in their diet. That's it. Okay, supplements and all that will be given by the consulting physician, whoever or the specialist, whoever they are. Okay. So carnitine is required in fat metabolism. How? It will take out the fat from your blood, okay, from the body tissues. It will push the fat into the cell cytoplasm where mitochondria, the powerhouse of the cell, is present. Okay, so this mitochondria will use up your fat, and this is where oxidation takes place. The fat is used up and energy is given out. That is the oxidation taking place here. Okay, so carnitine, people who are regular to gyms and all, you must know carnitine as a fat burner supplement. Have you heard about this? Carnitine based supplements are sold in regular market as it is marketed as fat burning supplement. It turns fat, basically turns fat into energy. Okay. You have to work out. If you are taking carnitine, you definitely have to work out because you have to produce that, you have to burn that energy. Okay. Fats is definitely going into your cell cytoplasm, mitochondria will be using it up, energy will be produced. You have to work it out, you have to burn it out. Okay, so that's the reason why carnitine supplements are very famous among fat burning supplements. Okay, even within your body, carnitine can be synthesized. Your body can make certain degree of carnitine. Nutrients like vitamin C, iron, niacin, okay, they all act as a cofactor, okay, to produce carnitine in your body. But if you are deficient in vitamin C, iron, niacin, etc., then carnitine cannot be produced. It cannot be synthesized adequately in your body. Okay, so most of the carnitine is definitely used by your skeletal muscles. That's why it can burn out the fat that is under your muscle tissue and give you a more leaner physique. Okay, so synthesis of making of carnitine in vegans and strict vegetarians is very much decreased because of the dietary deficiency of vitamin C, iron, and possibly niacin or vitamin B6. Okay, so vegans and vegetarians may have a risk of deficiency of carnitine. Okay, most of the carnitine is present in your skeletal muscles and not present in and some of them is present in other organ tissues or soft tissues, but most of the carnitine is present in your skeletal muscles. Okay. So what does L-carnitine does? L-carnitine is the name that you must be quite well known with, those who are working out in the gym and all. Okay, L-carnitine. So it assists in the breakdown of energy stores in the cell and plays an essential role in making fat available for your muscle tissue in the source of energy. Instead of going for glucose or glycogen stores, okay, it encourages muscles to use up the fat stores for energy. Okay, that's how it leads to losing weight, losing the fat mass from the body. Carnitine implies long chain fatty acids that are present in your body for energy, and it also leads to a healthy cardiac health. Okay, your risk of cardiovascular diseases can also reduce because long chain fatty acids are getting wiped out from the bloodstream. Okay, it gives you a more lean and a well defined physique. L-carnitine supplements. And people who have thyroid issues, specifically hypothyroidism, and anyone who is suffering from seizures, convulsions, or fits, you have to avoid taking this supplement. Okay. Anyone who is suffering from hypothyroidism and seizures, please avoid taking L-carnitine supplements because the metabolism is involved here. Okay. And the great food sources of carnitine, again, it's most of the red meats, Okay, lean meat, salmon, chicken, pork, beef, etc. Milk, dairy products. Okay, these are the good food sources of carnitine. In vegetarian food, we have a very less option. Avocados and whole wheat are sources of carnitine, but it is not a good source of carnitine. Okay, it's not feasible. It's not practical to have 5 to 10 avocados per day just to meet your carnitine requirement. Okay, it's not feasible like that. And also human milk, in breastfeeding mothers, human milk contains high carnitine content, and because of which it increases the metabolism of essential fatty acid in a breastfeeding infant. Okay. And if you are going for plant-based protein like soya milk or almond milk, coconut milk, or anything for vegans, they do not have any carnitine content in that. Okay. And also parental nutrition formula, TPN formula. Okay. That also will not have any carnitine content in that. And specifically, if you are a non-vegetarian, you can focus on red meat, but focus more on dark meat. Okay. Some of the dark fishes like in Hindi, we call it as surma. Are you aware of the fish called surma? I guess it is anjal or kingfish. We call it in English. That surma fish is a good source of carnitine because it has a dark flesh. Okay, fishes that are dark in color, fish who have all the fishes that have dark flesh. Okay, so these all are the good sources of carnitine. The darker is the color of the flesh of a meat, the more is the carnitine content to it. Okay. Next, we have coenzyme Q10. Coenzyme Q10. See, weight loss or weight gain for people who are suffering from thyroid issues, you have to first consult an endocrinologist. Okay, or you can go for other alternate medicines as well, Ayurvedic or allopathy. First, you have to take out the root cause that is giving you the weight gain or weight loss issues. Okay. First get a treatment for hypothyroidism or hyperthyroidism, whatever thyroid issues you're facing with. Only after that, your diet changes can affect you or accelerate your weight loss or weight gain. Okay. So coenzyme Q10 is a molecule used by human body during aerobic cellular respiration. Aerobic means in the presence of oxygen. Oxidation is taking place. Okay. So in the presence of oxygen, when energy is formed, in that particular pathway, coenzyme Q10 is a molecule that is used. So it does much of its work in the mitochondria of the cells, part of the cell where energy is produced, and it is also an antioxidant. Okay, it takes care that the free radicals which come out as a byproduct of an oxidation process. Okay, these free radicals do not hurt your healthy tissues or cells. So it acts as an antioxidant as well. So it is the most fat soluble antioxidant. So it can protect the areas which has fat lining, specifically your blood vessels. Blood vessels have a fat lining. It like inside of the blood vessels, if you can imagine, inside of the blood vessel, it has a very thin fat lining so that it is protected. The tissues of the blood vessels are protected from free radicals. Otherwise, what happens if the free radicals have access to hurt your blood vessels, tissues of the blood vessels? You are definitely going towards a cardiovascular disease. Okay, atherosclerosis, CVD. Okay, or any BP related issues can also harm you sooner. Okay, so what this coenzyme Q10, which is fat soluble antioxidant, does is it will go and protect the linings which are there inside your blood vessels. Thus, it is protecting the healthy tissues of your blood vessels against oxidative damage. Okay, so definitely people who suffer from heart failure, who has increased blood pressure, cardiologists usually will recommend them to have coenzyme Q10 as a supplement. Okay, coenzyme Q10 supplements are given. to people who have heart failure or who have high blood pressure issues. And to a certain degree, it is shown that to a certain degree, we are not sure about it, but it is mentioned in your textbook, to a certain degree, coenzyme Q10 can prevent occurrence of Parkinson's disease, migraines, okay. Generally, this coenzyme Q10 is found in your organs with high rate of metabolism, like your heart, kidneys, liver, okay, where energy has to be produced, it has to be transferred. So generally, these organ tissues, they already have coenzyme Q10. But basically, it is used for, in majority of the cases, it is used for cardiac health, people who have suffered from heart failure, people who are suffering from high blood pressure issues. These supplements are prescribed, okay. So these are the best food sources of coenzyme Q10, both non-vegetarian and vegetarian sources we have mentioned. So pasture-raised meats, organ meats like heart, liver, kidney are the richest source because it is produced also. Even in human body, heart, liver, and kidneys are the metabolic organs. High metabolic rate is seen in these organs. So definitely coenzyme Q10 is found in even human heart and liver and kidneys. High amounts of found. Same will apply to animal products as well. Wild caught fish, pasture-raised egg yolk, grass-fed butter, grass-fed cattle, their butter, okay, their dairy products, etc. Coming to vegetarian sources or vegan sources, avocados, olive oils, broccoli, cauliflower, sweet potato, nuts like pistachios, walnuts, sesame seeds, hazelnuts. Okay, most of your seeds and nuts are good sources of coenzyme Q10. So definitely switching the oil, like if anyone is suffering from cardiovascular disease, switching the oil from butter or ghee and converting them to use more olive oil is a better option here. And not just olive oil, canola oil, soybean oil, peanut oil. These are also the other options which you can go for if you are looking for coenzyme Q10 molecules. Next, we have lipoic acid, alpha lipoic acid. So it's an organosulfur component. It has a sulfur component to this. It's a fatty acid which has a sulfur component to itself. And it's an extremely important cofactor for various enzyme production. So your body produces a lot of enzymes. Lipoic acid is also. Please check again, peanut and groundnut are two different kinds. Okay. Peanut and groundnut are two different kinds of, they are from the same family, but I guess they are two different kind of nuts. Okay. Please check that. Olive oil can be heated. Okay. Olive oil has a high burning point. It can definitely be heated. There is no issues in that. Even if you are using virgin olive oil, it can be heated. Olive oil is known for its high burning point. Okay. So lipoic acid, like your body produces a lot of enzyme. In the presence of lipoic acid, it is lipoic acid is also alpha lipoic acid. It's a cofactor to produce more enzymes in your body. Okay, and it also has anti-inflammatory action to it. And it plays a major role in energy pathways. There are 3 different energy pathways: aerobic, anaerobic. Okay, like in the presence of oxygen, in the absence of oxygen. Both lipoic acid, it is both water soluble as well as fat soluble component, and it is considered as a universal antioxidant. It has a really good antioxidant complex to it. It acts as an antioxidant. So it helps in weight loss to a certain degree. Don't completely fall for this. It aids in weight loss. It does not causes weight loss. The presence of alpha lipoic acid in your food leads to a leaner physique. Okay, it will not burn up the fat. Okay? It leads to leaner physique. It is not stored in the cells. Okay, it is used up by your body. It limits the brain cell degeneration, maintains heart health. It benefits NEM stress response, that is your nervous system stress response, specifically in kids. The foods that are rich in lipoic acid, liver, kidneys, again, organ meat. When it comes to vegetarian sources, broccoli, spinach, sprouts, peas, tomatoes, these are the other good sources of lipoic acid. And it is also useful in people who are suffering from type 2 diabetes, rheumatoid arthritis, any cardiovascular disease, asthma, multiple sclerosis, tumors. If you see, most of these are inflammatory disease. Okay, so alpha lipoic acid is an antioxidant. It has inflammatory action. So definitely long-term management, long-term dietary management of any inflammatory diseases, you have to add food that contains food sources that are a good source of lipoic acid into the diet, okay, for that anti-inflammation benefit. Then we have inositol. So for inositol became famous because of its benefits in the PCOD, PCOS community. Okay. So in some studies, some researchers argue that inositol should be given the vitamin B complex status, but it is not it does not have the other principles of being a vitamin, but some researchers argue that inositol should be added as a vitamin B complex. Okay, so it's a pseudo vitamin, as we have mentioned earlier. All the vitamin-like substances we have discussed so far, they act like vitamins, but they do not have other components of being like a vitamin, like is it fat soluble or water soluble, etc. Okay. So inositol is found in a lot of familiar food that is homegrown, like muskmelon. Cantaloupe is also called as muskmelon. Okay, the another name for cantaloupe is muskmelon. In India, we usually use the term muskmelon. Cantaloupe is a more westernized terminology. Oranges, it is found in brown rice, liver, green leafy vegetables, but in when it comes to green leafy vegetables, in very small proportion. Okay. And there is no formal recommended daily intake for inositol. Okay. But coming to the benefits of inositol, most of the benefits of inositol has been associated with disorders like schizophrenia, psoriasis, ADHD, attention deficient hyperactivity disorder, ADHD, polycystic ovary syndrome. Okay, these are the certain mental health disorders as well as reproductive disorders to which inositol benefits a lot. Okay, it is able to break down the fats, and in particular the damaging fats, dangerous fats, which can lead to cardiovascular issues, etc. Okay, which can lead to fatty livers. Okay, so these are the dangerous fats which undergoes breakdown in the presence of inositol. Okay. Specifically, when it comes to PCO, dealing with the PCOS community, researches are still going on. We cannot say it for sure that inositol can cure PCOD. No, only it gives symptomatic management. Okay, PCOD or PCOS does not have a definite cure. Okay, you can only do dietary management, lifestyle management. You can do some symptomatic management. Okay. In some cases, after first pregnancy or so, the symptoms can just pass away. Okay, you will never see another symptom of PCOD or PCOS after your first pregnancy, but in some cases it can still come back again. Okay.